Hello, my name is Dr. Vaikuntan Rajaratnam. Today we're going to talk about the epidemiology of hand fractures and its distribution and to see the impact of that on the community. The incidence of hand fractures are very high, which accounts for about 10% of all fractures, and metacarpal fractures account for 30 to 40% of all hand fractures. The incidence among the 10 to 20 age group is quite high, accounting for about 38.8 fractures per 100,000 person years. From a British perspective, we published 1,000 cases of hand fractures and showed its distribution in the European Journal of Plastic Surgery. 1,000 patients were evaluated for hand fractures seen in the emergency department over 34 months, and we picked up 1,074 fractures. Majority were males in the ratio 3:1, with the age groups averaging 32.4 years. The mean age for the males were 30 years as compared to 40 in the females, and the right hand was predominantly affected with 650 cases. And about 6% of patients have sustained more than one fracture, and there were 2 cases of bilateral fractures. The majority of cases in the United Kingdom, the mechanism of injury was due to punching, and falls forming the second most common cause that were recorded. But do note that 50% of the cases, the mechanism of injury was not recorded. The small finger fractures were the commonest of all the fractures, and next was the ring, and these accounted for the majority of fractures seen in our series. This diagram shows the relative incidence of fractures in the various anatomical sites, and again you can see that the common fractures tend to occur in the metacarpus of the little finger and the thumb, the second common digit to be affected, especially in the metacarpal area. In our series, the management of the fractures was predominantly non-operative, accounting for more than 70% of the fractures, whereas the type of fixation in the 30-odd% that were operated were mainly plates and screws, 43%, interfragmentary screws, 22%, and percutaneous wire fixation was only 23%. The risk factor for operative fixation of fractures were mainly confined to the digits, the ring finger, proximal phalanx, and the thumb metacarpals, which have a higher risk of fixation than all the other fractures. In fixing fractures, biological osteosynthesis is the aim. Only the strict minimum of reduction is required with conservative operative technique so as not to interfere with the gliding mechanism of the soft tissues around the fracture, and the implants used must have the least amount of interference with the movement and the biological tissue. No absolute stability of reduction is required, as the loading is minimal as compared to lower limb. Angular stable implants can fulfill these requirements with the advancement in the modern implants with locking plate mechanisms. Treatment of fractures basically can be divided into operative and non-operative. Non-operative methods would be just to leave it alone when reduction is impossible to be maintained and makes no effect on the outcome. And this can be just splinted with soft dressings to allow for comfort, bandaging, and wrapping. Splinting can be utilized to ease pain, but it needs to be done carefully, and the customized splinting is ideal. Operative techniques can be one of various types. It can be percutaneous pinning of wires with significant amount of complications in the literature. It can be wiring with circularized wires, and it can use of external fixators or lag screws, plate device, intramedullary nailing, and fixed angle plating.